Are bioidentical hormones right for you? Postmenopausal women are often told that to alleviate symptoms associated with declining hormone levels such as hot flashes, night sweats, vaginal dryness, and mood swings, we should be using bioidentical hormones. These hormones are synthesized to be structurally identical to hormones naturally produced by the body, primarily estrogen and progesterone. The purpose for using hormones are that they can effectively alleviate menopausal symptoms, improving the quality of life for some women. But like anything else, there is risk versus benefit. While some studies suggest that hormones replaced therapy might have a protective effect on cardiovascular health and bone density, the evidence is mixed. On the flip side, there are potential side effects and risks associated with bioidentical hormone therapy, such as increased risk of certain cancers, long-term use of estrogen alone or combined estrogen and progesterone. Therapy may slightly increase the risk of breast cancer, ovarian cancer, and endometrial cancer. Hormone replacement therapy, particularly estrogen therapy, may increase the risk of blood clots, which can lead to serious conditions such as deep vein thrombosis or pulmonary embolism. Some studies have shown a slightly increased risk of stroke in women using hormone replacement therapy. Other side effects may include breast tenderness, bloating, headaches, nausea, and mood changes, which are typically the symptoms we are trying to alleviate. So you see, you are not likely fixing the problem by taking these hormone treatments. What makes more sense is to opt for a truly natural approach using nutritional supplements, dietary changes, and lifestyle modifications. Most women can find great relief from menopausal symptoms through these methods. Some potential natural approaches may include foods with phytoestrogens, such as flax and some legumes. Implementing the use of certain herbs, such as black cohosh, red clover, and dong quai, which are believed to have estrogen-like effects, may provide relief from hot flashes and other menopausal symptoms and can be super helpful. Lifestyle modifications, such as including regular exercise, stress management techniques, adequate sleep, and a balanced diet rich in fruits, vegetables, and whole grains, can all contribute to overall well-being during menopause and beyond. However, the absolute best way to determine what will work best for you is to dig deep, find out more about how your body is actually functioning, so you will know without a doubt what it is that your body truly needs to be at its best through menopause and beyond. This is what can be done using a functional medicine approach. We dig in, get to the nitty-gritty, to the true root cause. Once we do this, we will know exactly what is needed specifically for you. I'm looking forward to helping you on your journey. Please click below to schedule your complimentary call so we can get started.